Hello everyone, welcome to our channel. My name is Zetu. I am a registered nurse. Today I would like us to talk about the condition appendicitis. What is appendicitis? Appendicitis is the inflammation of the appendix. Appendix is a thin, long, blind-ended tube that is found on the right side of the lower abdomen. It is attached to the cecum, and cecum is the part of large intestine. What is the function of appendix? Appendix act as storehouse for good bacteria in the gastrointestinal tract, especially after diarrhea illnesses. It helps to keep a normal flora of the colon. What are the causes of appendicitis? Anything that can block the lumen of the appendix, it may lead to the inflammation of the appendix. Things that can block the lumen of the appendix is the calcified stone fecal matter that can block the appendix. Another thing that can block the lumen of the appendix, it can be parasite, especially the worms. And another thing that can block the lumen, it can be tumors. If the lumen of the appendix is blocked, the pressure within the appendix increased and the blood flow decreases. As a result of that, it leads into inflammation, which is appendicitis. What are the signs and symptoms of appendicitis? Abdominal pain. In some people, the pain may start on the navel area, but as the infection is getting worse, or as the appendix is getting more inflamed, the pain will be more located on the right hand side where the appendix is located. Nausea and vomiting is another sign. Poor appetite will be another problem. Fever and chills. Bloated abdomen. Some people may also present with constipation, and some people may present with diarrhea. Once all these signs and symptoms are noted on somebody that may be suffering from appendicitis, that individual need immediate attention. That person needs to be seen by the doctor. How the appendicitis is diagnosed. It will be history taking. When a doctor is taking history, he will be checking all the signs and symptoms that that person will be presenting. It will be physical examination that the doctor will be doing to confirm all the signs that patient can present. The blood will be taken, where the white blood cells count will be checked, and if there is a raise in white blood cell, and it means there is infection somewhere. Abdominal ultrasound will be done. Quite a lot of tests will be done until the diagnosis is confirmed. Once the diagnosis is confirmed, the doctor will decide how is he going to handle that person. Antibiotics will be given for infection, and doctor will advise or will recommend, depending on the status of the appendix, whether the patient can go for surgery. In severe cases, the surgery is recommended by the surgeon. The surgery that will be performed, it will be appendicectomy, which is the surgical removal of the appendix. Once surgery is discussed with the patient and the patient has been explained, the patient will be admitted into the hospital, will be monitored before surgery, and he will follow all the precautions that she's supposed to take or he's supposed to take before going to surgery. IV fluid will be administered to hydrate the patient because the patient is not supposed to take anything oral. On the day of surgery, the patient will be taken to theater where the operation appendicectomy will be performed. Appendicectomy can be done as an open surgery or it can be done laparoscopically. It depends on the surgeon and it depends how bad is the appendix is affected, and all that the doctor will decide. Once the operation is performed, and that patient will be kept in the hospital for some days to monitor all the complications that can follow post-surgery. In severe cases, you'll find that especially where the appendix has ruptured, the patient may come back into the ward with a drain because there will be a lot of fluid that they may need to be drained out from the abdomen. And because if the appendix ruptured, it may lead up into peritonitis. Therefore, they may wash the abdomen and they may also put a drain so that whatever that is left in the abdomen, and it must drain out. In the ward, that patient still need to be monitored closely for intake and output and make sure that the patient is improving safely. After some days, the patient will be discharged home with the instruction what to do while recovering from surgery. Patient will be advised to rest. A lot of rest is important while recovering from surgery. Patient will also be encouraged to take breathing exercises just to improve the lungs to work well, so that there is no accumulation of secretions into the lungs. And if the patient is coughing, you will also be encouraged to support the abdomen, whether talking or laughing. It is also important for the patient to start slowly to move around so that to prevent the complications that can follow if we are lying down in bed. Moving around will also help the patient to improve circulation and to prevent deep vein thrombosis. What is important is the education, so that the patient, even if the patient is at home, the patient will actually knows what to do. The patient will be discussed with the medication, and he must take the medication as prescribed. If the patient is facing any problem, the patient must feel free, and he must be given the numbers to phone if there is anything that is worried about. The patient mustn't wait for the clinic. If there is something that is not right, it is always advisable that the patient can phone the doctor, or he can communicate with the health workers in the hospital. The main purpose here, or our main goal here is to make sure that our patient recovered safely and is ready to be back to normal, or the patient, if it's working, will be ready to go back to work. What is important is education of our patient, so that we'll have the best results that we are looking for. For today, we will end up here, and until next time, thank you so much for the support. Thank you for all the comments that you guys are sending. Please share our videos, please subscribe, and please comment, so that we will try to upload more videos, so that we are all working together to promote our health. Stay safe and stay